Good afternoon, everybody. So I'll be presenting the abstract of the THOR study, which looked at patients who were previously treated metastatic bladder cancer with select FGFR alterations. That is, they looked at only 2 and 3. So we know that FGFR alterations are present in 20% of all patients. The initial phase 2 trial showed Erdafitinib to have response rates of nearly 40%. In a previously treated population. So that's pretty impressive. And then they had, of course, the phase 3 study, which is what I'm going to present now, whether it provided the survival advantage as well. So coming to the inclusion and exclusion criteria, they looked at all adult patients with metastatic or unresectable urothelial cancers with FGFR3-2 alterations, with a good PS, adequate organ function, and who have either progressed on at least not more than 2 lines of therapy, and which have included immunotherapy and a platinum-based therapy. So it's a very, very clinically applicable cohort. The key exclusion criteria was other malignancies, CNS symptoms, prior any FGFR inhibitor use, and corneal or retinal abnormalities, and history of uncontrolled cardiovascular disease or immunosuppression. So they looked at giving Erdafitinib 8 mg per day to a maximum of 9 mg per day versus it was essentially a physician choice chemotherapy, which was either docetaxel or vinoflenin. And they looked at a good primary endpoint of OS as opposed to DFS, which is what is mostly seen in palliative chemo trials. So at a median follow-up of 15.9 months, they found that the median age was around 67 years. 30% had only 1 line of therapy, while 70% of them had at least 2 lines of therapy. And they had a predominantly low PD-L1 scores of 90%. So many of them, even though they have received immunotherapy, had low PD-L1 scores. So coming to the results, it was 136 patients in the Erdafitinib group versus 113 chemo. Let's look at the OS first. Numerically appears better, 12 versus 7.8 months, with a hazards of 0.64. Confidence interval is also significant. So there's a 36% reduction in death. PFS also looks pretty good, 5.6 versus 2.7. For a urothelial cancer to have a PFS of nearly 6 months in the 3rd line is quite impressive. The hazards again 0.58 with a 42% reduction in progression, and overall response rates also were in tune of 40 to 46%, which was previously reported in their phase 3 cohort. The chief toxicity which they reported was actually hyperphosphatemia. So it's something that we need to look out for when we're giving this drug. GI side effects like diarrhea, stomatitis was the next common. And ironically, this also causes alopecia, not something that we expect routinely from targeted therapy. So thank you for this opportunity. No, they did not. They haven't, it's actually the abstract. They have not released the full paper. So they have to had at least 1 immunotherapy. Which immunotherapy it was, they have not released that. At least, I mean, I could not find it in public domain.